The Royal Melbourne Hospital is the oldest hospital in Victoria. It's one of 2 adult trauma centres within Metro Melbourne and covers the entire state of Victoria in Australia.
The need to understand our workforce utilisation and the performance of our assets were 2 crucial domains we had productivity losses in, and this was a catalyst for change. We wanted to become more efficient, more competitive, and more importantly, sustainable. We landed on a preferred product named TRIRIGA by IBM. IBM TRIRIGA has now evolved into an enterprise software used by in excess of 12,000 staff across the Royal Melbourne Hospital and its satellite services. We deployed on the fringe of a global pandemic in March 2020. As visitor restrictions were implemented, theatre capacity significantly reduced because electives were cancelled. The hospital lulled with an eerie quietness we'd never quite seen before as it prepared for a surge. The project team took this opportunity to dive into training every ward. Our services deployed their change and training champions, and we deployed IBM TRIRIGA 4 months ahead of schedule. This was very much about not waiting for the storm to pass, but learning how to dance in the rain. And the gamble paid off. We do not know what we would have done without TRIRIGA, a system that enabled our data capture, images, COVID workflows, and multiple types of reporting, and that included COVID tracing our non-clinical staff, accessing patient areas that quickly turned into hot zones. Not to mention the service demand across all our facility services actually saved us. We reviewed over 100 business processes that could be translated and fulfilled into a system process. A good example here is what we digitized in our cleaning department. Last year alone, our cleaning department generated over 24,000 infectious cleans. This has trebled since previous years. By moving away from a land page service and to a UX mobility device has reduced response times considerably. 2 years in, we can already identify many of the benefits as a result of our digital transformation. We've seen service response times by our cleaners improve by up to 85%. Our clinical assistant group and our emergency department assistants, who predominantly undertake those patient transfers across the hospital, 400 of them on any given day, have reduced their response times by up to 84%. Our paper, printing, photocopy and toner costs have all been reduced by 34%, and this of course has also had an environmental benefit, reducing an estimated 110 kilo of our CO2 emissions. We have reduced our reactive maintenance by 7% as we swing that pendulum to become more proactive maintenance rather than reactive. And we have improved access to our services like never before. Traditionally, there were 8 different ways you could access our service, and we've reduced this down to 1, single portal access. Whilst originally not in project scope, the pandemic saw a demand to support our clinical workforce and COVID activity. We used TRIRIGA to build workflows for our emergency department, short stay unit, radiology department, clinical equipment library, and peri-anaesthetics care unit. Whilst we think we've achieved much in 2 years, our appetite is only just getting started. And with our solid partnership with our solution provider, Trixie Building Insights and IBM, we hope to build on our roadmap.